Boys can either be circumcised, meaning that the foreskin covering the head of the penis has been removed, or uncircumcised, meaning that the foreskin is left alone. There's no right or wrong choice. Each family decides what's best for them. Like all choices, there are good things and bad things about each one. Circumcision avoids problems with the foreskin later, but one of the most common complications of circumcision is called meatal stenosis. The meatus is the opening through which a boy pees. It usually looks like a slit. Since meatal stenosis only happens to circumcised boys, we think it's related to irritation of the penile head rubbing against the diaper or underwear, now that it's no longer protected by skin. Over time, the slit-like opening starts to seal up. Eventually, it looks like a little web has formed on the bottom and zipped up the hole until only a small circular opening remains at the top. Sometimes the hole is so small you can barely see it. This is called meatal stenosis. Most people don't notice that the hole is very small. What most people notice are the problems that go along with it. The most common one is peeing up. Doctors call this a deflected stream, as the urine bounces off the web. Boys may compensate for it by pushing the penis down so they can still aim into the toilet. Parents often get frustrated that he's always peeing on the raised toilet lid and has bad aim. Some boys have even peed up over their shoulders or onto the ceiling or clear across the room. There are some other things you might notice when a boy has meatal stenosis, such as he may be peeing small amounts but very frequently. It may seem like he's not emptying his bladder all the way. He may suddenly have accidents, which is unusual for him. It may hurt him a little when he first starts to pee, especially in the morning. He may have a few spots of blood in the underwear, or the stream may be very thin and under high pressure. It is not good for the bladder to be emptying against such a high pressure. Over time, this can damage the bladder muscle. It can also cause urinary accidents, infections, and pain. For these reasons, we recommend fixing the problem. The procedure to fix meatal stenosis is called a meatoplasty. It will be traumatic to do this to an awake child, so it is typically done under a brief general anesthetic and usually doesn't even require a breathing tube. The procedure takes 10 minutes or less, and he goes home the same day. The opening is made bigger again, and tiny dissolvable stitches help it to heal the right way. Numbing medicine is given while he's asleep. Boys who have had this done tell us that it stings a little when peeing the day of surgery, but by the next day they are pain-free and often back in school. When the stitches fall off or dissolve, the stream is straight and strong again.